reform plan in place by this fall so that millions of uninsured Americans can have access to medical coverage.
Now, the price tag is pretty hefty, $1 trillion, and besides reorganizing some government funds to pay for it, there could be a tax hike for some of us. And joining us now to talk about funding and some other issues is U.S. Congressman Don Manzullo.
How are you today?
Good, just back
Good.
from Washington. So is it true, could there be a tax hike for some of us?
There's no question about it. The Congressional Budget Office, which is run, the directors appointed by President Obama, has said it could be as high as $1.6 trillion in new spending. And to pay for that, you absolutely have to raise taxes, and the taxes that are raised in this bill are mostly on small business people. It's about $800 billion worth. And by the way, this 1,016-page bill excludes,
makes for a light rating?
Well, yeah. It excludes from coverage members of Congress and the 400 or the 4 million federal employees. I'm not going to vote for a bill that excludes members of Congress and the federal employees. So you wouldn't even benefit,
or you would have nothing to do with this. It would have nothing to do with you or your health care.
Well, we would be excluded. In fact, there was an amendment that was before the Commerce Committee, brought by the Republicans, to make sure that members of Congress were passed under a bill that they want the American people to live under. That bill was rejected, with all the Democrats voting against it and all the Republicans voting in favor of it.
So you have issues with that big stack of paper right there.
Go ahead.
But what I was going to say is healthcare costs are more for Americans than any other industrial country,
That's correct.
industrialized nation.
Right.
I know medical debt is a principal cause of bankruptcy in the United States. So how can we cut the costs if that isn't the answer?
Absolutely. We do need health care reform. There's no question about it. Do you go about it through this approach that could easily wipe out all private health plans because of the public option being so expensive? And also, it could also wipe out about 4.7 million jobs, according to the President's Council of Economic Advisors, because of the pressure that's put on the employers.
So what would work better?
Well, what would work is the following. Association health plans that would allow small employers the ability to group together to have the large purchasing power that's available through, such as labor unions and through large corporations. Making sure that we have association health plans which have really worked in the past. They've helped bring down the cost of health insurance for employers. This bill wipes it out. We could have expand the community health clinics, such as Crusader Health Clinic here in Rockford, and finally expanding small business tax deductions so that small employers and people who are self-employed or people who don't make a lot of money would end up buying health insurance as opposed to paying income taxes. Those are all free market ways of doing it without putting the government in between the patient and his medical provider.
But how realistic is it to think that there would be some sort of consensus on that versus, what's going on here that's already being debated in Congress?
Nichole, under association health plans, which passed the House when Republicans controlled both bodies a couple of times, it got stalled in the Senate because you actually need 60 votes over there, and the only time it came up for a vote, it missed by 2 votes. Association health plans solve the problem of people not being able to get insurance affordably because of pre-existing illnesses. So there are all kinds of things that we can do that we've been working on for a long period of time, including tort reform on some of these malpractice cases that can be done on separate bills that can be put into effect without revamping entirely our health care system into a system that's untried, untested, and risky.
Well, we appreciate you being here with us today. And
we'd love to have you back once there's some movement on this, too, as the debate continues.
Thank you.
Thank you, Congressman Manzullo. Well, moving on to weather, where it looks like sunny skies could be in the not-so-distant future. Mark Henderson has the details now. Oh, he will have the details.